Hi, good evening. Welcome to Wednesday Reading Live. My name is Vandana PS, one of the reading trainers from Needus Academy. So, how are you everyone? നമുക്ക് എക്സാം ഉണ്ടല്ലേ സാറ്റർഡേ ഒരു എക്സാം വരുന്നുണ്ട് സോ വി ആർ ജസ്റ്റ് പ്രിപ്പയറിംഗ് ഫോർ ദി എക്സാം ഐ നോ ദർ ആർ ലോട്ട് ഓഫ് സ്റ്റുഡൻസ് ഹു ആർ പ്രിപ്പയറിംഗ് ഫോർ ദി എക്സാം സോ ഓൾ ദ വെരി ബെസ്റ്റ് അപ്പോൾ പ്രിപ്പറേഷൻസ് ഒക്കെ നന്നായിട്ട് പോട്ടെ അതിൻ്റെ കൂട്ടത്തിൽ വി ഹാവ് ടു ഡു സം കൈൻഡ് ഓഫ് അഡീഷണൽ വർക്ക്സ് ഓർ വി ഹാവ് ടു ഡു എ പാർട്ട് ബി എവറി ഡേ പാർട്ട് എ എവറി ഡേ പാർട്ട് സി എവറി ഡേ അപ്പം ഇൻ ടുഡേയ്സ് ലൈവ് വി ആർ ഗോണ ഡീൽ വിത്ത് എ പാർട്ട് എ മെറ്റീരിയൽ plus a sample question from part B. Okay, അപ്പോൾ പാർട്ട് ബിയിൽ ഒരു സാമ്പിൾ ക്വസ്റ്റ്യൻ ഞാൻ പ്രിപ്പയർ ചെയ്തിട്ടുണ്ട് സോ ജസ്റ്റ് ലൈക്ക് an എക്സാം മോഡൽ മെറ്റീരിയൽ ഒരു എക്സാം സാമ്പിൾ ക്വസ്റ്റ്യൻ ആയിട്ട് നമുക്ക് കൺസിഡർ ചെയ്യാം യു ക്യാൻ എക്സ്പെക്ട് ദിസ് കൈൻഡ് ഓഫ് എൻ ക്വസ്റ്റ്യൻ ഇൻ യുവർ എക്സാം ആസ് വെൽ ഓക്കെ സോ ആദ്യം തന്നെ ഫസ്റ്റ് ഓഫ് ഓൾ I'll give you 2 minutes for the preparation of the sample question and later on I'll just discuss the answers then let's move to this part of OET reading. So I hope you can see the material on the screen. So as I already mentioned, I'll give you 2 minutes for the preparation of this question. Then let's discuss the answers. Okay, so here comes the question. All right, so welcome back. Have you all done the material? So as I already informed earlier, this is a sample question from part B. Yes, I'm getting a lot of good evenings. Hi Ria. Yes, Sheena, Jovita, Jasta, Jagan, Shilpa, Arjun, Alfonso, Albi, Mary, Divya, Jenny, Vinny, Sheba, Nina, Lajay, Afsana. Good evening. Good evening, everyone. So how was the question? So did you feel like this is an exam model material അല്ലെങ്കിൽ ഒരു exam pattern question ആയിട്ട് തോന്നിയോ? Did you think so? Anyway, I'm going to read this question, then let's discuss the answer key of this question. All right. So the question is like, what is an essential aspect of infection control in healthcare settings? Okay. And as you guys know, already we have discussed a part B session before. നമ്മളൊരു പാർട്ട് ബി വളരെ ഡീറ്റെയിൽ ആയിട്ട് ഇതിന് മുമ്പ് നമ്മൾ ഡിസ്കസ് ചെയ്തിട്ടുണ്ടായിരുന്നു. ഐ ഡോണ്ട് നോ വെദർ യു ഗൈസ് ഹാവ് സീൻ ദറ്റ് പെർട്ടിക്കുലർ ലൈവ് സെഷൻ. അപ്പോൾ അതിൽ ഐ ഹവ് എക്സ്പ്ലെയിൻഡ് എവറിത്തിങ് അബൌട്ട് പാർട്ട് ബി ഇൻ ഡീറ്റെയിൽ. സോ വാട്ട് ഈസ് ദ ഫസ്റ്റ് സ്റ്റെപ്പ് ഓഫ് ഡൂയിങ് പാർട്ട് ബി? ഒന്ന് കമൻറ്റ് ചെയ്യാമോ അറിയാവുന്നവർ? ഹൗ യു ക്യാൻ ഡു പാർട്ട് ബി? ആൻഡ് ഐ ടോൾഡ് യു 5 different steps to do part B. And if you are just going through the 5 different steps in part B, definitely you can score 6 out of 6 in part B. Okay, അപ്പോൾ അറിയാവുന്നവരൊന്ന് കമൻറ്റ് ചെയ്തേ എന്താണ് ഫസ്റ്റ് സ്റ്റെപ്പ്. നമുക്കൊരു പാർട്ട് ബിയുടെ മെറ്റീരിയൽ കിട്ടിയാൽ വെൻ യു ഗെറ്റ് എ പാർട്ട് ബി മെറ്റീരിയൽ, വാട്ട് ഈസ് ദ ഫസ്റ്റ് തിങ് ഓർ വാട്ട് ഈസ് ദ ഫസ്റ്റ് സ്റ്റെപ്പ് ദാറ്റ് യു വിൽ ഡു? ആദ്യം തന്നെ നമ്മൾ എന്താ ചെയ്യാം? വാട്ട് ഈസ് ദ ഫസ്റ്റ് തിങ് ദാറ്റ് യു ക്യാൻ ഡു? യെസ്, വി വിൽ റീഡ് ദ ക്വസ്റ്റ്യൻ. നമ്മൾ ക്വസ്റ്റ്യൻ വായിക്കും അല്ലേ? So likewise, I'm going to read the question. What is an essential aspect of infection control in healthcare settings? Very good, Liji. Yes, we will read the question first. And what is the second step? So second step is you can underline the keywords from the question. Question la koduttirikkunna keywords correct ആയിട്ട് underline cheya. So my keywords from the question which are essential, then infection and healthcare. These are my keywords from the question. അപ്പോൾ ഇതൊക്കെയാണ് keywords. And what is the third step? Yes, Jagan, read the question. Yes, very good, Albi, read the question. Yes, Ria, read the question. Very good, very good. Hi, Adira, good evening. Yeah, so now we underline the keywords from the question. So what is the next step? Aditha step in the, what is the third step? So third step, understand the question. In part B and part C, it is very important we have to understand the question first, otherwise you guys will feel like there is a confusion around the options. അപ്പോൾ ക്വസ്റ്റ്യൻ മനസ്സിലാവാത്തൊരു സ്റ്റുഡൻ്റ് ആണെങ്കിൽ if you are a student who didn't understand the question, definitely you will not get the right answer. നമുക്ക് റൈറ്റ് ആൻസർ കിട്ടില്ല. The reason is that when you read the paragraph, just to confuse the students, they will mention the exact same line from the paragraph as an option. ഒരു ആൻസർ ഓപ്ഷൻ ആയിട്ട് ഒരു എക്സാക്ട് സെയിം ലൈൻ അവർ ഓപ്ഷനിലേക്ക് കൊടുക്കും. So if you are a student who didn't understand the question മനസ്സിലാവാത്ത സ്റ്റുഡൻ്റ് ആണെങ്കിൽ എന്ത് ചെയ്യും? They will pick that particular option. ഡയറക്റ്റ് ആയിട്ട് കൊടുത്തിരിക്കുന്ന ലൈനാണ്. ദിസ് ഇസ് ആൻ എക്സാക്ട് സെയിം ലൈൻ ഫ്രം ദ പാര. സോ ദിസ് ഇസ് മൈ ആൻസർ. ലൈക്ക്വൈസ് പീപ്പിൾ വിൽ സെലക്ട് എ റോങ് ആൻസർ. ഓക്കെ, സോ പ്ലീസ് ഡു അണ്ടർസ്റ്റാൻഡ് ദ ക്വസ്റ്റ്യൻ ഫസ്റ്റ്. എങ്ങനെയാണ് നമ്മൾ ക്വസ്റ്റ്യൻ അണ്ടർസ്റ്റാൻഡ് ചെയ്യാം? ടു അണ്ടർസ്റ്റാൻഡ് ദ ക്വസ്റ്റ്യൻ, സോ വി ഹാവ് ഡിഫറെൻറ്റ് കാറ്റഗറീസ് ഓഫ് ക്വസ്റ്റ്യൻസ് ഇൻ പാർട്ട് ബി. പാർട്ട് ബിയിൽ നമുക്ക് ഒരുപാട് കാറ്റഗറീസ് ഉണ്ട്. ആൻഡ് ഐ നോ യു ഗൈസ് നോ ദ കാറ്റഗറീസ് ഓഫ് ക്വസ്റ്റ്യൻസ്. നമ്മൾ ഇനി പാർട്ട് ബി ചെയ്യുമ്പോൾ ഐ വിൽ എക്സ്പ്ലെയിൻ വാട്ട് ആർ ദ 3 categories ഇൻ പാർട്ട് ബി. അപ്പോൾ ആദ്യം പാർട്ട് ബി കാറ്റഗറീസ് നമ്മൾ ഐഡൻറ്റിഫൈ ചെയ്യുന്നു. ആൻഡ് ദ അനദർ മെത്തേഡ് ഓഫ് അണ്ടർസ്റ്റാൻഡിങ് ദ ക്വസ്റ്റ്യൻ ഇസ് യു ക്യാൻ ട്രാൻസ്ലേറ്റ് ദ സെയിം ക്വസ്റ്റ്യൻ ഇൻ യുവർ മദർ ടങ്. യൂഷ്വലി നമ്മൾ ചെയ്യുന്ന പോലെ ഒരു മൈൻഡ്, ഒരു കോഗ്നിറ്റീവ് പ്രോസസ്സാണ് വാട്ട് ഈസ് ദ മീനിങ് ഓഫ് ദ ക്വസ്റ്റ്യൻ അല്ലേ? നൗ ആഫ്റ്റർ തേർഡ് സ്റ്റെപ്പ് വി ക്യാൻ ജസ്റ്റ് റീഡ് ദ ഓപ്ഷൻസ്. ഓപ്ഷൻസിലേക്ക് പോവാം. So the first option, so I hope you understood the question. Question is asking what is an important aspect of infection control where in healthcare. So option A, healthcare staff should wear PPE consistently throughout their entire shift. So my keywords, staff, should, then consistently. These are my keywords. Option B, regular hand hygiene is necessary before and after patient interactions. So my keywords, hand hygiene, necessary, interactions. And option C, waste disposal is the sole determinant of infection control effectiveness. My keywords, waste, then sole and determinant. So these are my keywords from these three options. And plus, I don't know whether you noticed it, നിങ്ങൾ അത് നോട്ടീസ് ചെയ്തോന്ന് എനിക്കറിയില്ല, in the question category is not mentioned. Questionൽ category mentioned അല്ല. അല്ലേ? If you are a normal student who don't know the categories of questions, you guys will not even bother about the categories mentioned or not. അപ്പോൾ കാറ്റഗറി അറിയാത്ത ഒരു സ്റ്റുഡൻ്റ് ആണെങ്കിൽ ക്വസ്റ്റനിൽ കാറ്റഗറി ഉണ്ടോ ഇല്ലയോ ഒന്നും ചെക്ക് ചെയ്യത്തില്ല. We will just read the options and read the paragraph. But if you are a student who know the category of questions, definitely you check for the category. എവിടെ category mention ചെയ്തിരിക്കുന്നത്? It is not mentioned in the question. അല്ലേ? ക്വസ്റ്റനിൽ മെൻഷൻ ചെയ്തിട്ടുണ്ടോ? ഇല്ല. Now, how will you identify the category? പിന്നെ നമ്മൾ എങ്ങനെ category identify ചെയ്യും? So there I'll give you a strategy or a small tip. Okay, ഒരു ചെറിയൊരു ടിപ്പ് ഞാൻ പറഞ്ഞുതരാം, ഒരു ട്രിക്കാണ്. That means if the question is asking you or if the question is framed like how to do something, when to do something or why it is important to do something, that will be a guideline. ഇപ്പോൾ ക്വസ്റ്റനിൽ ഫ്രെയിം ചെയ്തിരിക്കുന്നത് ഒരു കാര്യം എന്തിനു ചെയ്യണം, എങ്ങനെ ചെയ്യണം, how to do something. Or if the question is starting with when to do something, എപ്പോൾ നിങ്ങൾ ഒരു കാര്യം ചെയ്യണം. Or if the question is asking why it is important to do something, എന്തുകൊണ്ട് ഇത് ഇമ്പോർട്ടൻ്റ് ആയിട്ട് ചെയ്യണം. That particular that frame, the question frame is, you can connect it to the first category guideline. Alright. അത് എന്നിട്ട് നമുക്ക് കിട്ടുന്നില്ല എന്നുണ്ടെങ്കിൽ you can just read the first few lines from the paragraph. For something, if it is protocols mentioned, some rules and regulations mentioned, that will be a guideline for sure. Okay, so now I'm going to read the paragraph. So paragraph വായിക്കുമ്പോൾ തന്നെ you can go for elimination method. So the method we are applying in part B, that is called elimination method. നമ്മൾ part Bയിൽ apply ചെയ്യുന്ന മെത്തേഡിനെ പറയുന്ന പേരാണ് elimination method. Okay, so in part B, what is the method we are applying? That is skimming and scanning method. Here in part B, the method is called elimination method. Okay, so I'm going to read and you guys can read along with me. To minimize the risk of cross-contamination in healthcare environments, all staff must adhere to stringent infection control protocols. Stringent is a word which is a very common word. ഇതിപ്പോൾ പാർട്ട് എയിലാണെങ്കിലും ബിയിലാണെങ്കിലും സിയിലാണെങ്കിലും you can expect this word stringent. That means strict. Okay, strict. So, must adhere which means എന്താണ്? Follow. Adhere which means follow. Okay, so here adhere stringent infection control protocols. Personal protective equipment, that is PPE, should be worn appropriately and changed between patient interactions to prevent the spread of the pathogen. So very clearly mentioned in the very second line of the guideline. The guideline in the മനസ്സിലായല്ലോ, that is from the first category. So PPE should be worn, വേറെ ചെയ്യണം എന്ന് തന്നെയാണ് പറയുന്നത്, should be worn appropriately and changed between patient interactions to prevent the spread of pathogens. So from that particular line, you can eliminate which option? Option A can be eliminated because in option A it is mentioned healthcare staff should wear PPE consistently throughout their entire shift എന്നാണ് പറയുന്നത്. Where is it mentioned? Continuously they have to wear this PPE. No, between interactions, patient interaction വരുമ്പോൾ മാത്രം you can use this PPE. So contradictory option. I eliminated option A. Now, hand hygiene remains a cornerstone which means something very important, of infection prevention, requiring staff to sanitize or wash hands before and after patient contact. So, very directly mentioned here, what is important? Hand hygiene is important, necessary, cornerstone, before and after patient interactions. So maybe from that line I can trace towards option B. Maybe that is the right answer, I don't know. Additionally, surfaces frequently touched by multiple individuals such as bed rails, door handles and medical equipment must be disinfected at regular intervals. Individuals Something missed. Yeah, intervals using approved cleaning agents. Healthcare workers should also ensure that waste disposal procedures are strictly followed with hazardous materials. Hazardous which means dangerous. Alright. Being segregated separated and disposed of the designed containers. Institutions are encouraged to conduct regular audits to ensure compliance with these measures. Compliance nu panna obey cheyadana, obey. Okay, so likewise so that is that. So here, what is option C? Waste disposal is the sole determinant. Adu matram cheyda madi ennaanu parayunne. One more additional requirement is there, that is waste disposal. That is not the sole determinant. That is the only thing they have mentioned. So again, opposite option. So that answer is option B. അപ്പോൾ ഒന്ന് കമൻറ്റ് ചെയ്തേ, എത്ര പേർക്ക് ഓപ്ഷൻ ബി കിട്ടിയെന്നൊന്ന് കമൻറ്റ് ചെയ്യാമോ? കുഡ് യു പ്ലീസ് കമൻറ്റ് ഹിയർ യുവർ ആൻസർ. What is your answer for this question? Sample question from part B. Yes. Hi Reshma, good evening. Yes. Okay. So ആർക്കെങ്കിലും B option കിട്ടിയോ? Yes, Jovita got option B. Jenny got option B. Anyone else with option B? Yes, Lizzie, it is option B. Jasna, Ria, Afzana, Albi, Divya, Tinsy, Divya, yes, Sona, Alfonso, and Mary, Anu, right? Okay, very good, very good. Answer is B. But B is correct answer. Very good, Felba. Answer is right. Okay, so yes, very good, Adira. That is the right answer. That's all about part B. Okay, anything doubt undo? Any doubts regarding part B? If you don't have any doubts, let's move to part A. And today's part A material was so easy. Nalloru easy material aanu, yet the questions are a little bit tricky. Okay, and I hope you have downloaded the material from the page called Needhu's Academy Reading. And ഒരുപാട് സ്റ്റുഡൻസ് നമ്മളോട് ചോദിക്കാറുണ്ട് ത്രൂ the YouTube channel as well as this Facebook page. എങ്ങനെയാണ് കോൺടാക്ട് ചെയ്യുക, ക്ലാസ്സസ് അവൈലബിൾ ആണോ എന്ന് എങ്ങനെ അറിയുക. So likewise a lot of questions were there. So if you have any doubts regarding the classes, offline classes, whether online classes or offline classes, whatever it is, you can just contact on the number mentioned here. താഴെ ഒരു നമ്പർ കൊടുത്തിട്ട് on the screen there is a number, so which is 9747944374. So like please do you can contact to that particular number, okay, for any inquiries. Now let's move to part A. Yes, so we have new material today. This is not something a very new or a novel name for you guys. A very familiar name, അല്ല, varicose vein stripping. ഒരു പുതിയ പേരൊന്നും അല്ല, നമുക്ക് കേട്ട് പരിചയമുള്ള ഫെമിലിയർ ആയിട്ടുള്ളൊരു പേരാണ്. എനിവേ, മെറ്റീരിയൽ വേണം എന്നുള്ളവർ, ഇഫ് യു ഗൈസ് ആർ വാച്ചിങ് ദിസ് ലൈവ് ത്രൂ യൂട്യൂബ് ചാനൽ, പ്ലീസ് ഡു download the material from a Facebook page called Needhu's Academy Reading. So we have a page called Needhu's Academy Reading. There you will get the material. Okay, the lot of materials were there. The previous materials were there. So you can download the material from there. Okay. Hi Sankita. Yes Murli. Good evening. Yes Nina. A and C are opposite meaning. Yes, contradictory options are no. Hi Sanjukta. Yes Aksa. It is B. Very good. Very good. That is the right answer. Yes Anisha. Answer is right. Now varicose vein stripping. Okay. അപ്പോൾ ഇവിടെ this is very easy for you. If you have downloaded the material, you can set a 2-minute time for the material just for skimming and scanning. നിങ്ങൾക്ക് skimming and scanning ചെയ്ത് പഠിക്കണം എന്നുണ്ടെങ്കിൽ, if you want to study what is skimming and scanning, if you want to really learn what is skimming and scanning, you can download this kind of materials from the Facebook page, because ഇങ്ങനത്തെ മെറ്റീരിയൽ നമ്മൾ വായിക്കുമ്പോൾ will be like more comfortable reading. Okay, അപ്പോൾ ഇങ്ങനത്തെ മെറ്റീരിയൽ ഡൗൺലോഡ് ചെയ്തിട്ട് വായിക്കാം. So here, as you guys know, we have 4 different texts in part A, and one of the texts will be maybe a pictorial. Appo ivide oru pictorial undu, there is a table, not a table, a box mentioned here. It is all about adverse patient factors. And then we have a set of questions, varicose vein stripping questions. Okay, now first of all I'm going to read the material, then let's underline what are the important words mentioned, and let's check whether this material will help you. I mean the keywords will help you to find out the right answers. Okay, അപ്പോൾ വായിച്ച് കഴിയുമ്പോൾ നിങ്ങൾ ഓരോരോ എന്താ പറയുക question answers ആയിട്ട് please do comment it here so that I can check your answers. All right. So text A, it is varicose vein stripping. Varicose vein stripping is a surgical procedure that removes varicose veins from the legs or thighs. Varicose veins are just puffy, twisted veins that you can see under the skin. They usually have a red or bluish purple color. Varicose veins most often appear in the legs, but they may also develop in other parts of the body. Okay. Varicose vein stripping treats varicose veins and helps prevent them from coming back. The procedure is also known as vein stripping with ligation, avulsion or ablation. Currently, varicose vein stripping has largely been replaced by either intravenous laser ablation or radio frequency ablation. Both of these techniques are considered less invasive, safer, and more effective than vein stripping. So these are my keywords from text A, and text A was a very short text. Now, text B, varicose vein stripping is often done on the outpatient basis, which means you will be able to go home the same day as the surgery. The procedure typically takes 6 to 90 minutes. Your doctor may give you anti-anxiety medication to take beforehand. If you are receiving spinal anesthesia, feeling nervous about the procedure. During varicose vein stripping, your surgeon will make several small cuts or incisions near the top and bottom of your damaged vein. One incision will be in your groin, the other will be further down your leg, either in your calf or ankle. They will then thread a thin, flexible plastic wire into the vein through the groin incision. The wire will be tied and the vein pulled out through the cut in the lower leg. Your surgeon will then close the cuts with stitches and place bandages and compression stockings on your legs. So that's my keywords from B. Now it's C, infection. So what is mentioned about infection? It is not uncommon to notice some redness or hardness in your wounds, but if there is associated discharge, you have a temperature, then there will be infection. You should consult your GP or specialist who may prescribe a course of antibiotics. Then bruising. Second one is bruising. A degree of bruising is always present following vein surgery and usually resolves within 4 weeks. The bruising may be most marked in the thigh if the long vein is stripped and can be quite lumpy. Then third one is residual varicose veins. Although this is not strictly a complication, many patients will notice some varicose veins remaining after their operation. One must remember the surgery is performed to improve the symptoms of varicose veins rather than to remove every visible abnormality. Then the fifth one is deep vein thrombosis, that is DVT. This is a possible complication of any surgery, but is more common if you're overweight or a smoker. If a DVT is detected, you will require blood thinning tablets between 6 weeks and 3 months. So that's all about my keywords. And in text D, we have a lot of numbers and everything, brackets, everything. So adverse patient factors, relative contraindications to treatment, morbid obesity, BMI, which is greater than 30, extreme age or fragility, frailty, severe concomitant diseases, that is malignancy, cardiovascular or respiratory problems will be there, non-thrombophilia or history of previous DVT, needle phobic patients or those preferring treatment under general anesthesia. Very thin patients may be left with lumps where the veins were obliterated, which means destroy, or what can I say? Destroy is one meaning, then unevenness is another meaning. Patients or those preferring treatment under general anesthesia. Very thin patients may be left with lumps where the veins were obliterated following sclerotherapy and are less suitable for treatment. Adverse venomous anatomy, relative contraindications to treatment. Severe post-thrombotic damage to the deep veins, little advantage of treating VVS. Very large varices, more complications of skin pigmentation and lumps following treatment. Lesion. Then arteriovenous venous malformation, more difficult to treat. Absolute contraindications to the treatment, severe allergy to sclerosants. Obliteration of deep vein system, example following extensive previous DVT with no recanalization of deep veins. BMI, body mass index, DVT, deep vein thrombosis. So that is the full form for the abbreviations. Now that is my keywords from text D. Clear? Now we are going to deal with the questions. So please do comment your answers here so that we can discuss and I can correct your answers today. Okay. So today what I'm going to do is I'll just read 1 to 7 set of questions. I will just underline the keywords from the questions. Please do comment your answers from 1 to 7. Okay. So first question. The factors that make treatment measures difficult. So factors, treatment, difficult. Second question, how can we manage the occurrence of DVT post-surgery? Manage occurrence post. And third one, measure taken by the doctor to ease the discomfort in patients during the procedure. Measure doctor discomfort. And fourth one, what are the current approaches practiced alternative to varicose vein stripping? Current approaches alternative. How long should be the candidate of the surgery stay in hospital once the surgery is done? So how long candidate stay? Sixth one, why do we conduct varicose vein stripping? Conduct is my keyword. And seventh one, the significant sign of onset of infection after the procedure is. So my keyword, significant infection after. Now please do comment your answers from 1 to 7. Yes, on the comment here, 1 to 7 set of questions. What are the answers for 1 to 7 set of questions? Yes. Hi Anita. Hi Shini. Yes, please do comment your answers. 1 to 7 set of questions. So first one is factors. Treatment. Difficult. So what are the factors can cause the difficulty in the treatment? Yes. Okay, Lizzie. Very good, Lizzie. Very good effort. Yes. Yes, Sankita. Very good effort, dear. 1 to 7 set of questions. Yes, very good. Okay, Sheena. Yeah, what about others? Please do comment your answers. Yes, Nina. It is very good, dear. Very good. Okay, Brian, it's D. First one is D. Okay, what about the rest of the questions? Yes, Beulah. Very good, Beulah. Okay, dear. Very good. Yes, Vinny. All right, Arunima. Very good, Arunima. Okay, Ria. Jasna. Very good, Jasna. So I think I'm going to write the answers now because already you know the answers. Everybody is commenting the answers correctly. Alfonso, Albi, Aditya. Very good, Aditya. Yes, Afsana. Very good. Okay, so I'm going to write my answers here and you can check and you can ask me if you have any doubts regarding that. All right. So the factors that make treatment measures difficult, which is mentioned in D. If your answer is correct, you can put a tick mark there. That means you scored 1 mark. All right. Second question, how we can manage the occurrence of DVT post to surgery? So my answer is C. Yes. And the third one, measure taken by the doctor to ease the discomfort in patients during the procedure. And my answer is B. Fourth one, what are the current approaches practiced alternative to varicose vein stripping? So that answer is A. Fifth one, how long should the candidate of the surgery stay in hospital once the surgery is done? So fifth question answer is B. Sixth one, why do we conduct varicose vein stripping? Any idea? What about sixth one? Answer is A. And seventh one, the significant sign of the onset of infection after the procedure is, my answer is C. Okay, so now please let me know in the comment box how many students got 7 out of 7. എത്ര പേർക്കാണ് 7 out of 7 കിട്ടിയിരിക്കുന്നത്? ഒന്ന് കമൻറ്റ് ചെയ്യാവോ? If you do you have any doubts regarding that? Of course you can ask me in the comment box. Okay, എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടെങ്കിൽ നിങ്ങൾക്ക് ചോദിക്കാം, no problem. I'll just definitely gonna clear your doubts. Yes. Okay, now I'm gonna read your answers. എത്ര പേര് റൈറ്റ് ആണ് നോക്കട്ടെ. Okay, Lizzie, DCB, yes, and BAAC. Okay, very good, dear. Yes, Ankita, very good, right answers. Yes, Neena, very good, right answers, Neena. Yes, Beulah, very good, dear, right answers. Arunima, right answers. Yes, Ria Babu, Jasna, Albi, Alfonso, Aditya, Afsana, Atra, right answer. Yes, Alina. Yes, Brian, right answer. Yes, Divya, TC, it is right answers. DCB, AB, yes. Very good, Sheena, right answers, dear. Anita, Shilpa, Shini. Yes, Krishna, Jovita. Yes, Sona, Jagan. Okay, very good. And you guys got 7 out of 7, right? So see, actually each and every material have the same standard. When you attend your exam as well, you will get this kind of a material. ഇങ്ങനത്തെ മെറ്റീരിയൽ തന്നെ ആയിരിക്കും. And sometimes students are like, ഇത് ഭയങ്കര ഡിഫിക്കൽട്ട് ആയിരുന്നു ഈ മെറ്റീരിയൽ. And sometimes you will say, it is very easy. That is all your mindset. If you know certain words and everything, that means every material is the same. നമുക്ക് word meanings അറിയാമെന്നുണ്ടെങ്കിൽ, if you know the synonyms, if you know the word meanings, definitely all the materials are easy. Okay, so try to collect some word meanings for reading. and start reading today itself. Make reading as a habit. Okay, or a habit ആയിട്ട് മാറ്റിയാൽ reading is a very easy module. All right. Yes, so congratulations everyone, 7 out of 7. Now I'm going to do 8 to 14 set of questions. But doubt on 1 to 7, I think everybody got the right answer. So now we are going to do 8 to 14 set of questions. 8th one, consumption of which drug may help to get rid of infection? Yes. 8th one. So my keywords: consumption, drug, and get rid of, which means to wipe off, to just mitigate the consumption. So ഏത് മെഡിസിൻ എടുത്താലാണ് ഇൻഫെക്ഷൻ മാറുന്നത്? which drug? That is the question. We have to write the name of the drug there. What is the name of the drug? Which drug will help you to get rid of the infection? Either you can tell me it is from which text, or you can tell me the name of the drug. ഏത് ഡ്രഗാണ് അവർ മെൻഷൻ ചെയ്തിരിക്കുന്നത്? വെരി ഗുഡ് ജഗൻ, റൈറ്റ് ആൻസർ. ആൻസർ ഇസ് ആൻറ്റിബയോട്ടിക്സ്. ആൻഡ് അണ്ടർ ദ ടൈറ്റിൽ ഇൻഫെക്ഷൻ they have mentioned you should consult your GP or specialist who may prescribe a course of antibiotics for infection. So that answer is antibiotics. എത്ര പേർക്ക് antibiotics കിട്ടി? I know majority you got antibiotics. That is the right answer. Okay. Yes, antibiotics. That will be the right answer. Very good, Jasna. Yes, Sanjukta, Alina, Afzana, everybody got the right answer. Antibiotics. 9th one, minutes needed for the procedure to be completed. So minutes needed and completed. That means they are asking the time. What is the total time for the completion of the procedure? എത്ര സമയം വേണം പ്രൊസീജിയറിന്? And that kind of information regarding the procedure, I think it's mentioned in text B. Yes, varicose vein stripping. Very good, very good. Yes, Krishna, Felba, Albi, Liji, Jovita, Atara. Very good, very good. Antibiotics. Very good, Brian. So what about 9th one? എത്ര മിനിറ്റ് വേണം പ്രൊസീജിയറിന് വേണ്ടിയിട്ട്? ആൻസർ ബിയിലാണ് ഇരിക്കുന്നത്. Yes, 60 to 90 minutes. So if you have underlined the numbers from the text, definitely you will get the right answer. അപ്പോൾ numbers ഒക്കെ I'll give you another trick. Okay, ചില സ്റ്റുഡൻസ് ആർ ലൈക്ക്, ഞാൻ കണ്ടിട്ടുണ്ട് സ്റ്റുഡൻസ് മാർക്ക് ചെയ്യുന്നത് നമ്പേഴ്സിനൊക്കെ അവർ സർക്കിൾ ചെയ്യും. they will circle all the numbers. So that is, അപ്പോൾ ഞാൻ ചോദിച്ചപ്പോൾ അവർ പറഞ്ഞു, മാം, if the question is asking any numbers like how many, how much, what is the time, അങ്ങനെയൊക്കെ ചോദിക്കുമ്പോൾ we need that, we know that answer is a number. So we don't have to read the complete ones. We can just go through the circles. ഇപ്പോൾ സർക്കിൾ ആയിട്ടാണ് നിങ്ങൾ നമ്പേഴ്സ് നോട്ട് ചെയ്തെങ്കിൽ, if you just circled all the numbers, you can just go through the circles. അപ്പോൾ അത് കുറച്ചും കൂടി ഈസി ആണെന്ന് പറഞ്ഞു. So I just found out that's quite easy method. So likewise you can apply that kind of a technique. അപ്പോൾ നമ്പേഴ്സ് എല്ലാം സർക്കിൾ ചെയ്യുക, നെയിംസ് എല്ലാം നമുക്ക് അണ്ടർലൈൻ ചെയ്യാം. So likewise you can mark everything like a lot of, with some kind of different signs. Okay, അപ്പോൾ സർക്കിൾ ചെയ്യുക, അണ്ടർലൈൻ ചെയ്യുക, അല്ലെങ്കിൽ സിക്സാഗ് പോലെ വരയ്ക്കുക. So likewise you can do anything. Okay, so that you can remember a lot of things. Now it's time for the next question. So answer is 60 to 90. That is the right answer because already minutes mentioned in the para. So answer is 60 to 90. Okay, then 11th one, how much should the body mass index, that is BMI, for the patients to undergo different management methods? So BMI, how much, and management. Yeah, so where is it mentioned? How much? Again adoru number ആണ്. So numbers mark ചെയ്തിട്ടുണ്ടെങ്കിൽ you can just go through the numbers there. So here, yeah, BMI is mentioned here like greater than 30, I think. So is that the right answer? വേറെ എന്തെങ്കിലും BMI related ആയിട്ടുള്ള നമ്പർ മെൻഷൻ ചെയ്തിട്ടുണ്ടോ? How much the BMI? Yes, Afsana, Atira, Geetu, Felpa, yes, Sania, Albi, Shini, Jasna, Neenu. Yes, right answer. Okay, it's greater than 30. So that is mentioned in text D. As you can see there, it's greater than 30. That is the right answer. Okay, that is the right answer. Then 11th one, maximum time required by the bruises to get turned off after its occurrence post surgery. Okay, greater than 30 in if you're writing 30, both are right answers. Okay, symbol aayathukonde you can just put the symbol there. And 11th one, maximum time required by the bruises to get turned off after it occurrence post to surgery. Yeah, so my keywords maximum time and post surgery, so that you can underline bruises. Again, time ആണ്. Yes, what is the time required? Maximum time required. Okay, so answer is 4 weeks. Very good, right answer. So answer is 4 weeks. And where is it mentioned 4 weeks? Again, time only. So you can just go through where is numbers mentioned. Other than this greater than 30, I don't think that any other number is mentioned in text today. So here 6 to 3 weeks mentioned, but nothing mentioned about maximum time. But here it is mentioned, see, a degree of bruising, bruises keyword, is always present following a vein surgery and usually resolves within 4 weeks. So what is the maximum time? 4 weeks. Okay, so the answer is 4 weeks. Very good, very good. Okay, everybody got the right answer. Very good, yes. And now it's 12th one. Acute allergic to which medication during the management may make the process difficult? So my keywords, acute, medication, difficult. Yes. What about 12th question? Acute allergic to which medication during the management may make the process difficult? The medication aana? Yes. Medication the pair enda koduthikkune 12th question. Yeah, 4 weeks is the right answer. Very good, everyone. So what about question number 12? Get your answer. What about 12th question? I think medication complications mentioned in text today, right? But in here, any medications mentioned? Very good, Jagan. It is sclerosins. Yes, G, sclerosins is the right answer. I think sclerosins we have seen here. See, this is the medicine. Severe allergy to sclerosins. So absolute contraindications to treatment if it is severe allergy to sclerosins. So answer is sclerosins. Okay, that is the right answer. So which is sclerosins. So what is the spelling? SCLEROSANTS, sclerosins. Okay, yeah, I don't know how it is changing. Anyway, it is changing. Okay, 13th one. The cut in which part of the body is utilized to insert a thin flexible plastic wire into the vein? So which part and plastic wire? So where is plastic wire mentioned? Which part of the body mentioned? Anywhere mentioned the part of the body and some kind of a cut. I think in B the procedure is mentioned. So I've seen some kind of incision here. That means a cut. So one incision will be in your groin, the other will be farther down your leg, either your calf or ankle. And yep. So they will then thread a thin. So what is the right answer? I think it's a groin. Yeah. Okay, see, where is the groin mentioned? I don't know. You guys are commenting like the groin. Anywhere the groin mentioned, the article mentioned? I think the answer is groin, right? They have mentioned one incision will be in your groin, right? Yeah, so where is the groin mentioned? Yes, Jovita, where is the mentioned? The parayunnundo. Everybody mentioned cheythekkunne. Yes, Anjukta, where is the groin mentioned? It is just groin, okay? Answer is groin. That is the right answer. Yeah, groin on answer varunathu, which is GROIN, groin. Okay, which is groin. So answer is groin. G, it looks like CR. Okay. Yeah. Which part of the body is predominantly impacted by varicose veins? So part predominantly impacted. Yes, that means which part of the body is affected by varicose vein? Yes, it is leg, right? Do you want to write leg or legs? I think it is legs. Because 2 legs, yeah. Legs will be the answer. Varicose vein stripping, varicose vein appear in the legs. So here answer is legs. There you can write the article, okay, no problem. You can write the legs. Okay, here it is, the legs, because article mentioned on it, so that you can write the legs from text A. Okay, now that's that. So all I think you will get full marks for 8 to 14 set of questions. Final, I mean, after the discussion, let's discuss your answers. I mean, your marks, okay? So now 15th question. Unsuitable patients are those left with unevenness where the vein no longer exists following dash. Unsuitable, left with unevenness. Unevenness ആണ് ഞാൻ നേരത്തെ പറഞ്ഞത്, that is obliteration or something അല്ലേ. Vein no longer exist. No, unevenness is not no longer exist. Yeah, that is an important word. No longer exist, yes. Okay, so what is the missing word there? Unsuitable patients are those left with unevenness where the vein no longer exists following dash. Yes, majority wise are just typing like legs എന്നൊക്കെയാണ്, but answer is the legs. Okay, article ഉണ്ടല്ലോ, so answer is the legs. Yeah, what about 15th one, guys? What about 15th question? Very good. It is sclerotherapy. That is the right answer. SCLE, sclerotherapy. Yeah. And I think it's mentioned in D. I found that word in text D. Somewhere here. Whereas sclerotherapy mentioned very thin patients with maybe left with lumps where the veins were obliterated following sclerotherapy are less suitable for treatment. I think sclerotherapy is the right answer. Yeah, sclerotherapy, that is the right answer. Yes, yes. And 16th one, the patient will be discharged the same day of the procedure because it is usually done on the dash basis. What basis? Either basis ilana outpatient basis, I guess. Because I've seen that particular words in text B, I don't know. Let's see. എവിടെയാണ് പറയുന്നത്? In text B, where is outpatient? Varicose vein stripping is often done on outpatient basis. See this very first line. So my answer is outpatients. Okay, outpatient. Outpatient. Okay, then 17, varicose veins are subcutaneous, entangled and swollen, which is dark red or dash in color. Only two colors mentioned in the para, which is I found in text A. One was red and another one is bluish purple color. So answer is bluish purple. And don't forget to put the hyphen. Okay, നിങ്ങൾ hyphen ഇടാൻ വിട്ടു പോകരുത്, because hyphenated words are so important in OET. So blue, what is blue? Not bluish, right? It's not blue, bluish purple. Bluish purple. Yes. Then 18th one, the dash can be seen mostly in the thigh if the long vein stripped and may exhibit unevenness. What can? Yeah, bluish purple color. Please do put the hyphen, okay? Yes, bluish purple, yes. Just very good, just nice. It is bruising. Bruising is the right answer. So my answer is bruising. And where is bruising mentioned? I think it's mentioned in text C. Where is it mentioned text to be? The bruising may be most marked in the thigh if long vein is stripped and can be quite lumpy. So that is bruising, all right. And 19th one, ablations either by dash or radio frequency, the two recent approaches got in place of varicose vein trapping. It's actually stripping, as they are minimally invasive. So ablations, radio frequency and invasive. Yeah, what about that one? Ablation is already mentioned here. So what is the right answer there? What is the answer vera? So all the keywords we have seen in text A, right? Nammal text A la words akka kandadu. So I found answer from text A, I guess. The word ablation is here. Currently, varicose vein stripping has largely been replaced by either endovenous laser ablation or frequency ablation. See? So what is the right answer here? There pairana, so that you can write endovenous laser ablation or you can write endovenous laser. Both are correct. Okay. Yes. So it is endovenous laser or you can write ablation. Yeah, later ablation. Laser ablation. Okay. 20. Dash tablets are imperative for the DVT patients for between 1 month and 3 months. What tablets? Any tablets mentioned there? DVT it is mentioned. I think it's in text to say I found DVT. And for DVT, any tablets mentioned? Deep vein thrombosis. This is possible complication of any surgery, but it is more common if you are overweight or a smoker. If DVT is detected, you will require blood thinning tablets for 6. Okay, answer is blood thinning. See, again, hyphen is there. Hyphenated word, so blood thinning. So please don't forget to put the hyphen. Answer is blood hyphen thinning. What is the spelling of thinning? T-H-I-N-N-I-N-G. T-H-N-N-I-N-G. Okay, that is thinning, right? Yeah, T-H-I-N-N-I-N-G. Yeah, don't forget the spelling. Okay, that is the right answer. Anyway, so these are the answers for today's part A material. Clear? Any doubts, anyone? And now please do let me check your answers. Plus, I just want to know what is your marks for today. Petra better right answers under. Yeah. Okay. Yes, Anita, Liji, Ria, Jagan, Sheena, Beulah, Afzana, Shilpa, Anita, Neena, then Divya. Okay. Yes, Atira, Anita. Yes, Vincent. Yes, Atira. Okay. ഒന്ന് മാർക്ക് ഒന്ന് കമൻറ്റ് ചെയ്ത് എത്ര പേർക്ക് റൈറ്റ് ആൻസേഴ്സ് ഉണ്ട്, എത്ര പേരുടെ ആൻസേഴ്സ് ഒക്കെ കറക്റ്റാണ്. 20 ഔട്ട് ഓഫ് 20 ഉണ്ട്, അല്ലെങ്കിൽ ഐ ഗോട്ട് 19, 18. സോ ലൈക്ക് വൈസ് കുഡ് യു പ്ലീസ് ടെൽ മി യുവർ മാർക്സ്. ഇന്ന് മാർക്കും കൂടെ കണ്ടിട്ട് നമുക്ക് വൈൻഡപ്പ് ചെയ്യാം. യെസ്, എത്ര പേർക്കുണ്ട് 20 ഔട്ട് ഓഫ് 20? Anyone with 20 out of 20? ഉണ്ടോ? അതെ. യെസ് അഫ്സാന, യെസ് ജസ്ന, അതിര 19. ഇറ്റ് ഇസ് പ്രെറ്റി ഗുഡ്. ഓക്കെ. യെസ് ജഗൻ, ഐ തിങ്ക് ജഗൻ്റെ മാർക്ക് പോയിരിക്കുന്ന എനിക്ക് തോന്നുന്നു. ആർട്ടിക്കിൾ സെറ്റ് ചെയ്തിട്ടില്ല അല്ലേ? ദ ലെഗ്സിന് എഴുതിയിട്ടുണ്ടാവില്ല. ഐ തിങ്ക് സോ, ഐ ഡോണ്ട് നോ. യെസ് ജീന 16th ആൻ ഔട്ട് പേഷ്യൻറ്റ് വേണോ? ലെറ്റ് മീ ചെക്ക്. ഓക്കെ, ഔട്ട് പേഷ്യൻറ്റ് നമുക്ക് നോക്കാം. ആൻ ഔട്ട് പേഷ്യൻറ്റ് ആൻ ഉണ്ടെങ്കിൽ യു ഹാവ് ടു റൈറ്റ് ദി ആൻ ദെയർ, ബിക്കോസ് ആർട്ടിക്കിൾ അവിടെ ഉണ്ടെങ്കിൽ ആർട്ടിക്കിൾ നമ്മൾ മെൻഷൻ ചെയ്യണം. ഇഫ് ഇറ്റ് ഈസ് നോട്ട് മെൻഷൻഡ് ഇൻ ദ ക്വസ്റ്റ്യനിൽ ആർട്ടിക്കിൾ ഉണ്ടോ? വെരി ഗുഡ് ഡിയർ. ആൻ ഔട്ട് പേഷ്യൻ്റ് എന്നാണ്. ലെറ്റ് മീ ചെക്ക് ദ ക്വസ്റ്റ്യൻ വൺസ് അഗൈൻ. വേണ്ട, ഇറ്റ് ഈസ് ഹിയർ, ഇറ്റ് ഈസ് ഓൺ ദ എന്നാണ് പറയുന്നത്. സോ ആർട്ടിക്കിൾ ഇസ് ഓൾറെഡി ഹിയർ. ഓക്കെ, ഇത് ആർട്ടിക്കിൾ ആണല്ലോ. സോ ദാറ്റ് ഇസ് ഓൾറെഡി മെൻഷൻ ദെയർ. സോ യു ഡോണ്ട് ഹാവ് ടു റൈറ്റ് ദ ആർട്ടിക്കിൾ. വേണ്ട, ആർട്ടിക്കിൾ വേണ്ട കേട്ടോ. ഓക്കെ ജഗൻ, യെസ് വിൻസെൻറ്റ് 18, വിനി 18, നീന 19. ഐ നോ മെജോറിറ്റി യു ഗോട്ട് കെയർലെസ് മിസ്റ്റേക്സ് ആയിരിക്കും നിങ്ങൾക്ക് അല്ലേ? യെസ് ജഗൻ, ദ ലെഗ്സ് ആണ്. ഓക്കെ, ജസ്ന 19, ലെസ് ജി 20, അനീഷ 18, നീലാംബരി 18. വെരി ഗുഡ് ഡിയർ. യെസ് ഓക്കെ. അപ്പം ദാറ്റ്സ് ഓൾ അബൌട്ട് ടുഡേയ്സ് പാർട്ട് എ ആൻഡ് പാർട്ട് ബി. ഇനി നെക്സ്റ്റ് this Friday you have a surprise, because Neetu ma'am will be here with another writing depiction. Okay, അപ്പോൾ എല്ലാവരും അറ്റൻഡ് ചെയ്യുക. all the very best for the exam students. I mean exam എഴുതാൻ പോകുന്ന എല്ലാ സ്റ്റുഡൻസും all the very best. God bless you all. Take care. Thank you.